Cormac Russell's been talking about like people who are in positions to serve the population, how because we're putting them in that position and we're looking at them from a deficit-based perspective, like they need something, then when we do something to them, it's harmful. So as opposed to looking at the person and saying, well, this is a patient who needs my services, this is a person who wants to have a healthy life. What can I do to assist them along their health journey? It's like a different way of looking at healthcare. If we think about social determinants of health and how really as healthcare providers, we provide maybe 20% of what a person might need in order to help them get better. The rest of that, where they live and what they have access to, how they live as far as what they consume or how they exercise, like those are things that they have that has more of an impact over their health than the parts that we do. And so maybe there's a better way for us to utilize how we serve in our role to guide them. So more of a guide along their health journey versus being the purveyor of access to health. It just is a different way of looking at things. That's what I'm working through right now. Every human being is so different. So for instance, there's one physical therapist that I learned about who has a company, and she really likes to hike apparently. So she goes to where it's a very famous place where people go to hike from all over the world, and she just sets up her van, and as hikers come through and get injured, which they typically do, she's there to provide services to help them either get back out of where they are as far as being injured and back to their home, or just if they're need to continue going, she's there to kind of patch them up and help them out. And she also has a telehealth component to her business. And I thought, now that's meeting people where they are. It's not waiting for them to come into the clinic to see you. I know that there's a great population of people who enjoy hiking. I'm going to take full advantage of that population to help assist them in their journey. So that's kind of the way I'm looking at healthcare. There's so many, right now it's like, oh, there are too many PTs, there's too many this, too many that. It's like, no, there are not enough physical therapists to address all the, lifestyles that people live in. So maybe there's a different way of looking at how we, provide services. When I think about leadership, some people think about it as I'm going to go up the next level in my company, or in this institution. I look at my leadership journey as more of I'm spreading out. So what can I do in the space that I'm in to have the greatest impact? And right now I'm leading a DPT program. But that allows me to help this population with the institution I work in, and also to help various, programs within the institution. However, my role in ACAP allows me to help assist other programs, around the country. But as far as the next level, I think my leadership journey is not going to be inside of any walls of any institution. So that's probably guiding people from a remote location along their health journey or along their leadership path. So I think that's probably the next level for me.